Hello, Dr. Meredith Hayes here. In a previous video, we had a frank discussion about why continued masturbation is so important for a man's health as he ages. We talked about prostate health, penile tissue preservation, and even immune function. The response was overwhelming, and it brought up a crucial follow-up question that many of you asked. How do I do it safely? This is not a trivial question. A man's body at 65 is different from his body at 25. The skin is thinner, the tissues are less resilient, and recovery can take longer. What worked without a second thought in your youth can now lead to irritation, discomfort, or even injury if you're not careful. Today, as a urologist, I am going to address this head-on. We are going to discuss the 3 most common and potentially harmful mistakes that men over 60 make when they masturbate. Avoiding these mistakes is the key to ensuring that this healthy, beneficial practice remains safe and pleasurable for decades to come. Let's talk about it.
Let's first acknowledge a reality. As we age, our bodies change. The skin, including the delicate skin of the penis, loses collagen and elasticity. It becomes thinner and more prone to friction, chafing, and micro-tears. The blood vessels are not as robust, and the nerves can be less sensitive, sometimes leading men to use more force or pressure than is necessary or safe. Furthermore, conditions that are more common in older age, such as arthritis in the hands, can affect your grip and dexterity. All of these factors mean that we need to approach self-pleasure with more mindfulness and intention than we did in our younger years. The goal of masturbation in later life is not just about achieving a quick orgasm. It's about pleasure, yes, but it's also about connection with your own body, stress relief, and, as we've discussed, vital physiological maintenance. To achieve these goals, safety and comfort must be the top priorities. Unfortunately, due to a lifetime of this topic being taboo, most men have never received any formal guidance. It's a self-taught practice, and the techniques developed in youth are often carried into older age without modification. This is where the problems begin. Today, we will correct that. We will break down the 3 most critical mistakes I see in my clinical practice. For each mistake, I will explain why it's a problem for the aging body and provide a simple, practical solution. This is the conversation you probably never had, but absolutely need to hear now. Let's get right into it. These are the 3 things you must avoid. Mistake number 1, the dry technique, insufficient or improper lubrication. This is, without a doubt, the number 1 cause of problems. Many men are used to masturbating without any lubricant, relying only on saliva or nothing at all. While you might have gotten away with this in your 20s, it's a recipe for disaster after 60. Why it's a problem: friction and chafing. The penile skin is thinner and drier with age. Without proper lubrication, the friction from your hand can easily cause redness, irritation, chafing, and painful micro-tears. This can make the penis sore for days and increase the risk of infection. Peyronie's disease risk. This is a serious concern. Peyronie's disease is a condition where scar tissue, called plaque, forms under the skin of the penis, causing it to bend or curve during an erection, which can be painful and make intercourse difficult or impossible. The aggressive friction from dry masturbation, especially with a firm grip, can create microtrauma over time, strongly linked to this condition. Desensitization. Using a death grip to compensate for lack of lubrication can, over the long term, desensitize the nerve endings, meaning you need more and more aggressive stimulation to achieve orgasm. The solution: use a high-quality, body-safe lubricant. This is non-negotiable. You must use a lubricant. What to use? Choose a water-based or silicone-based personal lubricant. Water-based lubes are easy to clean up and feel very natural. Silicone-based lubes are more slippery and last longer, excellent for more sensitive skin. What to avoid? Do not use soap, shampoo, Vaseline, petroleum jelly, or body lotion. Soaps and shampoos strip the skin of its natural oils and can be extremely irritating. Vaseline is difficult to clean and may trap bacteria, increasing infection risk. Lotions often contain perfumes and alcohols that can burn or irritate sensitive skin. How to use it: be generous. Apply a quarter-sized amount of lubricant to your hand and directly onto the penis before you begin. Reapply as needed. The goal is a smooth, effortless glide, not a rough, friction-filled struggle. This one change will revolutionize the safety and pleasure of the experience. Mistake number 2, the death grip using excessive force and pressure. This often goes hand in hand with the first mistake. Men who don't use lubricant often compensate by gripping the penis very tightly to increase sensation. This is a dangerous habit. Why it's a problem: vascular damage, the erectile tissues, corpora cavernosa, and the blood vessels within them are delicate. Squeezing the penis too hard can damage these small vessels, leading to bruising or, in the long term, contributing to the fibrosis we discussed earlier. You are literally crushing the very tissues you need to be healthy for good erections. Nerve damage: a grip that is too tight can compress the sensitive dorsal nerves that run along the top of the penis. Over time, this can lead to numbness or a permanent decrease in sensitivity. Creating a stimulation bias: if you consistently use a death grip, your brain will begin to require that intense, crushing pressure to reach orgasm. This can make it very difficult to achieve orgasm with a partner, as the sensation of a vagina, mouth, or a partner's hand is much gentler. You are training your body to only respond to an unnaturally intense stimulus. The solution: lighten up and explore different sensations. The goal is to stimulate, not to strangle. The OK grip: instead of wrapping your whole fist tightly, try using just your thumb and forefinger in an OK sign. This naturally encourages a lighter touch. Use your palm: experiment with using your lubricated palm for broader, gentler strokes. Focus on different areas, don't just focus on the shaft. Pay attention to the frenulum, the sensitive area on the underside of the head, the corona, the ridge of the head, and the perineum, the area between the scrotum and anus. Using your fingers to gently stimulate these areas can be incredibly pleasurable and reduces the need for a tight grip on the shaft. Mindfulness: pay attention to the sensations. Close your eyes. The goal is to feel more with less force. This retrains your brain to appreciate more subtle, nuanced sensations, which will dramatically improve partnered sex as well. Mistake number 3, the finish line mentality: rushing to orgasm. Many men masturbate with one single goal: to reach orgasm as quickly as possible. It becomes a task to be completed, a release to be achieved. This finish line mentality robs you of the majority of the pleasure and health benefits. Why it's a problem: increased stress and anxiety. Rushing puts your body into a state of stress. You produce cortisol, and your focus narrows. This is the opposite of the relaxed, parasympathetic state that is ideal for healthy sexual response and pleasure. Missed pleasure: the journey to orgasm is often more pleasurable than the destination itself. By rushing, you are skipping all the wonderful sensations of the arousal phase. You are turning a potentially rich, 20-minute experience into a frantic 3-minute one. Poor ejaculatory control: if you always rush to the finish line, you never learn to recognize the signs of impending orgasm or how to control it. This can lead to premature ejaculation, both during masturbation and with a partner. You are not training your body for endurance. The solution: practice edging and mindful arousal. This is a technique that urologists and sex therapists have recommended for decades. It's the single best way to increase your pleasure, improve your ejaculatory control, and make you a better lover. What is edging? Edging, or the stop-start technique, involves masturbating to the point where you feel you are about to have an orgasm, the point of no return, and then stopping all stimulation completely. The process: bring yourself close to orgasm. Stop. Let the intense urge subside. This might take 30 to 60 seconds. Breathe deeply. Once you feel more in control, begin stimulating yourself again. Repeat this cycle 3, 4, or even 5 times before finally allowing yourself to have an orgasm. The benefits of edging: intensified orgasms. The final orgasm after edging is often much more powerful, explosive, and pleasurable because you have built up so much sexual tension. Improved ejaculatory control. You become intimately familiar with your body's signals and gain conscious control over the point of no return. Increased stamina. You are training your body and mind to sustain high levels of arousal for extended periods, which translates directly to longer-lasting partnered sex. Mindfulness and pleasure. It forces you to slow down, to pay attention, and to savor the entire process of arousal, turning a chore into a deeply pleasurable and meditative experience. Let's review the path to safe, healthy, and pleasurable masturbation after 60. 1. Abandon the dry technique. Always use a high-quality, body-safe lubricant. Your skin will thank you, and you'll protect yourself from injury. 2. Release the death grip. Use a lighter touch. Focus on sensation, not force. This protects your tissues and retrains your brain for greater sensitivity. 3. Forget the finish line. Slow down. Practice edging. Learn to control and extend your arousal. This will multiply your pleasure and make you a more competent lover. Gentlemen, self-pleasure is not a race. It is a practice. It is a form of self-care that has profound benefits for your physical and mental health. By approaching it with mindfulness, intention, and the right techniques, you can ensure it remains a safe, joyful, and vital part of your life for as long as you choose. This is about respecting the body you have today, not treating it like the body you had at 20. With a little knowledge and care, you can continue to enjoy a healthy and satisfying sex life for many, many years to come. If this practical advice has been helpful and has given you the confidence to approach this topic with more care, please hit that like button. It's a powerful signal that this kind of frank, educational content is needed. Subscribe to my channel for more essential men's health advice, and be sure to ring the notification bell so you don't miss our future conversations. And now, in the comments, I'd like to ask, what is one piece of bad advice you've heard about sex or masturbation that this video has helped to correct? Let's use this space to dispel myths and support each other with good information. Thank you for your trust and for being here for this important discussion. Disclaimer: this video provides general educational information. If you experience pain, discomfort, or any concerning symptoms related to sexual activity, please consult with your personal healthcare provider. Thank you.